Good afternoon. It's noon in the Triad, and that means it's time for Empowering You. I'm Alvin Atkinson, and it is my pleasure to be with you for the next hour here on WSNC 90.5 FM and Empowering You. Empowering You is the public affairs program that shines a light on the work being done by local nonprofit organizations, governmental agencies, and community corporate initiatives that seek to make us the best us that we can be. Today, the fourth Sunday in March, March, Women's Empowerment Month. Also, March, the beginning of spring. Wow. We're so pleased to have joining us today from the Forsyth County Public Health Department, Ms. Keyla Lewis Fleming. Good afternoon, Keyla.
Good afternoon.
Welcome to Empowering You. I know this is your first time in the studio, and yes. I want you to feel comfortable and share with our listeners what is your title and the work that you do.
Yes, so I am the Improving Community Outcomes for Maternal and Child Health Program Coordinator at the Forsyth County Health Department.
Okay, so that's quite a bit, right? Yes.
Yes.
In fact, you all have some letters. What do y'all call it?
So it's ICO4MCH.
ICO4MCH.
Yes.
Did I get it right?
Yes, perfect.
I'm listening. Great. So help us understand then, how did this effort get started?
Yes, so we applied for this state grant through Guilford County, and by this we were able to see that we need to improve some of the community outcomes in Forsyth as well. So Guilford County did ask us to be a part in this grant, and yes, here we are.
So, and what year was this?
This was like 2 years ago.
2 years
when
ago.
It first.
So we've been doing this for a little while now.
We have. We just got it up and running. Really, I just started this position in January, so now we're able to actually replicate and do some of the things that Guilford did.
Now, this is exciting. We're getting some new information here. So I understand there were three basic areas that we are focused on. Could you share with us what those were?
So in the grant, the work that we do, we want to improve birth outcomes. We want to reduce infant mortality and improve the health status of those ages 0 to 5.
Okay, so let's start with that first one then. We improve birth outcomes.
Yes.
Tell us about that.
Yes, so in order to improve birth outcomes, what we have been doing and implementing is a perinatal peer education program where we are partnering with different colleges. We are able to implement different reproductive life plans. We have mothers and babies, which is like a focus group for mom, and it kind of focuses on her stress and her mental health and just helps her navigate through.
Okay, so then I needed to ask this question. And I'm glad because we have some listeners who may have just joined us. We're talking with Keyla Lewis Fleming, who's a public health educator here in Forsyth County in our public health department. And we're talking about this Improving Community Outcomes Maternal and Child Health program.
Yes.
Why did we even apply for this? That's what I want to know.
So why did we apply? So in the state of North Carolina, Guilford County and Forsyth County have been in the top 5 counties with the highest infant mortality rate. So there's definitely work to be done, and we want to do it on all levels.
Okay, so it wasn't a good thing that we had to do this, that we had high infant mortality rates. And,
yes.
And so you're just beginning in January and got underway, and you mentioned the improving birth outcomes. The other area you said was reduce infant mortality. What are we doing in that area?
So we know that infant mortality is the death of an infant before they turn 1 year old. So in order to do this, we have wanted to expound upon breastfeeding and really bring more awareness to breastfeeding, especially in the Black community, to destigmatize some of those stigmas and to pretty much make it work for mothers.
So what are some types of activities you would do?
So right now we are, like I said, it's a collective action grant, so it's a community impact grant. So we need work on all levels. Right now what we are implementing is a breastfeeding collaborative, which Guilford has already implemented, and that is something that brings experts and community members together. Here in Forsyth, we are currently working on creating lactation-friendly spaces, so that is our Making It Work initiative. In that, we go to different businesses to kind of see, do you have a lactation-friendly space? Is there a space for mom to breastfeed? Things like that. So we are trying to make sure that in the community we have these resources available as well. We partner with WIC, as they are the #1 breastfeeding educators in the world. So we partner with them.
Wait a minute. I'm not a woman or mother, and you said WIC. What is WIC?
WIC. So WIC is Women, Infants, and Children.
Okay. So you partner with that. And, now you call those things lactose. What do you call it?
So lactation-friendly spaces. So those are areas that mom can breastfeed privately, in her comfort, just somewhere that she could pump, breastfeed, and do whatever she needs to do in private.
In the airport, I'll go through there and I saw those things. But that's what we're talking about. Okay, and so we're actually having them placed.
Yes, we are working to do that in the county to make sure that these businesses do have somewhere. Yes.
Beautiful. Then why is breastfeeding so high of a concern here?
Yes, so we are trying to implement a way to increase the initiation and continuation of breastfeeding. Sometimes we don't really get to see that in our community. Sometimes we don't get to feel as supported in our community. So we know that breastfeeding has some great things, benefits for the mother and for the baby as well. So that's why it's important to kind of spread the education about breastfeeding.
Well, when I was growing up, breastfeeding was really the way to go.
Yeah, yeah.
Now, you're young. Why do you think we have stigmatized breastfeeding now? Why do you think?
I think we are just on the go a lot, and a lot of the times it's not convenient to breastfeed, right? A lot of the times some people may not have the best experience with starting to breastfeed. Baby may not latch, so that's why it's important to get those tools that we need so that we can figure out what the root cause of the problem really is when it comes to breastfeeding.
Now, so breastfeeding is one thing, and that's an approach to reduce infant mortality.
Yes.
What kind of measures for improving birth outcomes? What do you think we're doing to make the change? Are you talking to mothers now, or?
Yes, so we are in the implementation stage of having mothers and babies. Like I said, that is more of a focus group that deals with mental health of mom and baby. And then we are trying to get everyone equipped with the knowledge. So starting at different levels to educate. So having those peer educators, which are college students, and those that are of different ages and community members that can educate the community as well.
Now I get it. So you're using the college students, peer educators, talking about this so that the information can be received
spread on
by
all
the
levels.
mothers.
Yes.
Awesome.
Yes.
Well, this is great. Are you excited about this opportunity?
I'm super excited. I'm ready to get it all running. I'm ready. Yeah.
Right. So how long do you think? How long is the grant?
So it is 2 to 3 years. I believe it will be implemented for 3 more years. So yes,
after this?
Yes. And fingers crossed, it keeps on.
Oh yeah. Well, we got. I
keeps
want
on
you to
rolling.
Be successful,
right.
We need healthy. It's particularly and specifically in Black and brown communities.
Yes.
Is that a focus of your efforts?
Yes, it is.
So,
it is.
Which we're talking about improving the health status of children birth to 5. What is the work that's happening in this area?
Yes, so right now we are partnering with different organizations, especially the Parenting Path right now, to provide Triple P, which is a positive parenting program. And this program helps families feel confident and reduce stress. We are still expanding and trying to find more families in order to do that, but Triple P is a way for families to come together, talk about strengths and weaknesses, and also have evidence-based strategies to help approach those, conflicts or difficulties that they might see in parenthood. So doing that, child health will be improved.
Okay. Triple P. I tell you, we got all these alphabets going around, and that is Triple P again is
Positive Parenting Program.
Positive Parenting Program, and we're partnering with
The Positive Parenting Path. Yes.
Positive Parenting Path, a
Yes.
Triple P agency in our community. Well, great information for us, and we do want to shift gears only slightly to hear from a couple of other guests who have some important matters that's connected with this. So I want to thank you for coming and starting us off today.
Yes, thank you for having me.